One of the reasons that it is so devastating that COVID cases are rising so rapidly and the hospitalizations are rising so rapidly is that our public health system, the actual people who make up it, have had a devastating year and a half. Many of them at or past the breaking point. And so when you see things like, if we can put up the photo again, the fact that nurses and doctors are gonna be treating COVID patients in garages again, it's not that surprising to find out that some of them are just ready to be done with this whole thing. And so I wanna show you a bit of an interview I saw with a nurse in Mississippi about their experience. So let's go to that.
Wearing our masks and doing what we need to do. We're tired. Nurses are so tired. It's getting to the point where we need help. We've been helping as much as we can, and we need help from, our community. I respect everybody's choice to get vaccinated or not, but when it comes down to it, it's going to just continue to get worse, and it's going to get to the point where it affects our kids. We are. That's my biggest fear. People aren't doing what they need to do to protect us. And we're human. We're not robots. We're not machines. We can't continue to do this forever at this capacity.
You're a nurse on the ICU floor right now, but you're not going to be.
No, I can't do this anymore. I've seen more death than I ever thought that I would see my entire life. It's heartbreaking in every way. I don't even know how to describe it. It's overwhelming.
So that is a nurse who has been dealing with this every day, who went to the field knowing that she was going to see a lot of death, a lot of suffering. I mean, she works in an ICU, it's sort of expected. And she has been broken by this experience, at least in terms of the ability to continue doing it on a daily basis. And we can just, sort of hope that she's an outlier, that there will always be doctors, there will always be nurses. But we're finding out in a lot of places already that is not the case. Texas, I don't know if you saw this, Ben, Texas is having to import doctors from other states because they can't actually treat all of the patients that they have. Now that may be sustainable for a little bit, that we can just take doctors from one state, send them to Texas. But what about when those states need their doctors? Think about the dominoes as they fall when it comes to that. So what did you think about that video?
Yeah, I mean, seriously, like this is where it all comes to planning, right? This is where it all comes to planning. I mean, 6 months into this pandemic, we basically knew, and I mean, honestly, anybody who really knew what they were talking about, anybody that's like an epidemiologist that studied coronavirus even a little bit knew that basically after 6 months, it's pretty much guaranteed that coronavirus is gonna mutate to the point where we're always racing against coronavirus. And even if we rolled out a vaccine, it still wouldn't have done enough, and we're dealing with it right now with vaccine resistant strains. It's going to become like cyclical, like the flu, not necessarily seasonal with like a regular cycle, but it's going to like mutate so that we're always struggling against it. What should have happened, the response should have been rapidly training people to augment nurses and medical staff, right? Maybe that means like pulling people out of like active duty or the National Guard, training them how to do like intubation and like basic like treatment for COVID patients. Maybe it means like doing rapid training programs for people doing like associate's degrees or like, entry level like nursing degrees and stuff like that. Like just ramming people through those programs so they can help augment people in hospitals. That is what should have been done. None of that has really been done. And we're just working people to death. We're working people to death, literally, as like even nurses and doctors are keeling over from coronavirus because they're dealing with coronavirus patients every day.
Exactly. Yeah, no, that would have been a great idea. Add that to the long list of things that we could have and should have done in that first year that we didn't, because we had not the best leadership, but we had a complete lack of leadership during the greatest time of domestic crisis in our lives here. I don't know if something like what you just laid out is being done under Biden. I hope that it is, because this isn't going away anytime soon.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.